Hello, my name is Dr. Dewan S. Raja. Today I will discuss about multiple choice questions on chemotherapy for leukemia, mostly the adverse effects of chemotherapy in a patient with leukemia and its prevention. Let's start with question number 1. A patient with leukemia is undergoing a chemotherapy regimen known for its nephrotoxic potential. How does maintaining adequate hydration contribute to reducing the risk of chemotherapy-related renal toxicity? Choices are A. By preventing electrolyte imbalances, B. By diluting the concentration of chemotherapy drugs in the bloodstream, C. By promoting urinary excretion of chemotherapeutic agents, D. By reducing the risk of central nervous system toxicity, E. By improving the oxygenation of renal tissues. So what is the correct answer? How does maintaining adequate hydration contribute to reducing the risk of chemotherapy-related renal toxicity? Answer should be C. By promoting urinary excretion of chemotherapeutic agents. So you need adequate hydration. Answer is C. By promoting urinary excretion of chemotherapeutic agents. Question number 2. A patient with leukemia is undergoing chemotherapy by the prescribed regimen includes drug known to cause significant nausea and vomiting. How does hydration contribute to the management of chemotherapy-induced nausea and vomiting in this patient? A. By directly neutralizing the emetic effects of chemotherapy drug. B. By enhancing absorption of anti-emetic medications. C. By diluting concentration of chemotherapy drug in the bloodstream. D. By preventing electrolyte imbalances associated with nausea. E. By reducing risk of central nervous system toxicity. So how does hydration contribute to the management of chemotherapy-induced nausea and vomiting in this patient? Answer should be B. By enhancing absorption of anti-emetic medication. By enhancing absorption of anti-emetic medications. Usually in chemotherapy, one anti-emetic drug is induced also. Question number 3. A patient with newly diagnosed leukemia is scheduled to start chemotherapy known to pose a high risk of tumor lysis syndrome or TLS, which is aggressive. Why is aggressive hydration a crucial component of the management plan in this scenario? A. To prevent chemotherapy-induced nausea and vomiting. B. To minimize the risk of allergic reactions to chemotherapy drugs. C. To maintain blood pressure and prevent hypotension during chemotherapy. D. To promote renal excretion of uric acid and prevent tumor lysis syndrome. E. To enhance the distribution of chemotherapy drugs in the bloodstream. So, what or why is aggressive hydration is crucial component of the management of this scenario to prevent tumor lysis syndrome? What is the answer? Okay, Answer: to promote renal excretion of uric acid and prevent tumor lysis syndrome. Answer is D. To promote renal excretion of uric acid and prevent tumor lysis syndrome. Question number 4. During chemotherapy for leukemia, which laboratory parameters should be closely monitored to assess and manage myelosuppression? A. Complete blood count. B. Liver function test. C. Serum electrolyte. D. Serum creatinine. E. Serum lactate dehydrogenase. So, what should be closely monitored? Question number 4. Our idea is to check and manage myelosuppression. So, which laboratory parameters should be closely monitored? Answer should be A, that is complete blood count, CBC. Complete blood count, CBC. That is essential to check, assess and manage myelosuppression. Question number 5. In acute promyelocytic leukemia, a patient is receiving chemotherapy. At what platelet count threshold is the risk of spontaneous bleeding significantly increased, necessitating urgent intervention? Okay. Answer should be what? Platelet count less than 150,000 per cubic millimeter. Platelet count less than 100,000 per cubic millimeter. Platelet count less than 80,000 per cubic millimeter. Platelet count less than 50,000 per cubic millimeter. Platelet count less than 30,000 per cubic millimeter. So what is the correct answer? Okay. To prevent spontaneous bleeding, what we can do is specifically in acute promyelocytic leukemia. Okay. Necessitating urgent intervention. When will do urgent intervention? Answer should be E. Platelet count when goes down 30,000 per cubic millimeter, then we must take necessary intervention. It may be fresh blood or platelet infusion. Because of this low count of platelet, we need platelet replacement, platelet infusion. Answer is E. And that's all about the MCQs on chemotherapy for leukemia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.